What we're looking at here is Jeff's chart. This was his initial appointment when he came in back in 2020. I didn't have much time with Jeff, but we were trying to figure out if he had a structural leg length issue, or maybe what could we do to increase his performance and how his body was functioning. So what we were finding is he had a lot of dysfunction in his pelvis, quads were very tight, a bit of a rotation in his scapulas. You can see some wedging here in his temporal bone. Basically, we were seeing he was collapsing to his left side. So we went about the treatment trying to alleviate that dysfunction, came to the conclusion that Jeff needed a lift in his shoe. So we implemented a full foot lift. He didn't get it immediately, but within, I'd say 6 months ago, he's got that in place. So if we fast forward to this year, we can now see Jeff's new position. So here we can see the 5 millimeters correcting. His initial measurements were actually a bit higher, so his body in a sense kind of overcorrected. The reason it had overcorrected was because of a certain amount of cranial pressure. We can see the vectors here, the wedging in the head, and basically this flexion was being mimicked throughout his body. When it mimics itself, in the same ear and the same hip, it actually creates a functional imbalance as well too. So my goal for Jeff today was to make sure his lift was truly correcting. He didn't need to be 6, he didn't need to be 4, he didn't need to be 7 millimeters. So had him retake his measurements after we balanced his sphenoid and rebalanced his cranium to get those vectors to go away. Once those vectors were gone, the purple lines here indicate his later position. So the blue would have been where he came in, right hip was higher, front of the right hip was lower, trochanter was slightly lower, and basically this hip was flexing, causing this knee to hyperextend. So we got that tension out of there, got the cranium to rebalance, and then the purple measurements are where we landed after the fact. So trochanters are level, front of the pelvis is level, hips are level, his shoulders actually balanced out, his clavicle balanced out, which is actually a representation of what the spine is doing, and then his cranium you can see balanced out as well. Now our goal for Jeff in the future is going to be to recheck to make sure that he stays stable. We want to make sure he maintains that level foundation, so he maintains a level roof. And then we're going to start working more on the extremities. So we can go into the shoulder girdle, start to work more on the deltoids, internal rotation, external rotation, start to get those things to improve so he's not collapsing or wanting to slouch on himself as much. But at least we know that the structure itself when he's walking and when he's training is as symmetrical as it can be, so that the things that we work on later are more of accessory dysfunctional patterns, issues that aren't maybe the primary source, but can contribute to causing the body to deviate back into a compensation again. So great improvements, and this was the second treatment over probably a 2-year span.